all the winners from tonight.
Thank you so much, Angela. All right, so it is my pleasure to bring us to our second presenter. And so we are now going to hear from Dermatologist Choice Skincare. Scottsdale dermatologist Dr. B founded Dermatologist Choice in 1981 to help his patients achieve dermatology strength results at home. Formulated with non-neutralized glycolic acid, Dermatologist Choice smooths fine lines, which we could all use, reduces breakouts, and evens out texture and pigmentation for a healthy glow. Gia contributes her experience in corporate marketing and sales as the Dermatologist Choice president. At Dermatologist Choice, we are passionate about truly serving the customer by providing clinical skincare that works. And then keep in mind that as Gia is talking to us with Dr. B today, if you have questions for them, if you have thoughts, toss that into the chat and we'll make sure that we spend some time answering those questions at the end. Gia, if you need to screen share or anything, just let me know. Otherwise, I'll have this up in the background.
Yeah, thank you, Stephanie, so much. Thanks for having us. That was fantastic introduction. As mentioned, my name is Gia. I'm the president of Dermatologist Choice, and so excited to be here with Dr. B, the founder. So we're going to get right into it, but yeah, we definitely want to let a lot of time for questions because skincare can definitely be a very personal thing, and we have Dr. B here to really give us all that value and to really help you individually with your skin concerns. So take it away, Dr. B.
Hello, I'm Dr. B, and it's a pleasure to be here. It's in 1981, about 40 years ago, that was the time when Retin-A, the retinoids, were coming onto the market. And everybody found that with all the use of retinoic acid, that everybody's appearance had improved. Now, we have had experience for many years with different other retinoid acids. You know, citric acid was used by Cleopatra many years ago, and then there's an acid called phenol acid that back in the 30s we used to eliminate all the wrinkles. But in the late 70s, early 80s, Retin-A came out, and that was now found to work for wrinkles, which then led us, because that was a prescription, now we had to find something, well, what can we use that isn't by prescription? And that's when the glycolic acid and the alpha hydroxy acids came out. Now, glycolic acid, because it's made from sugarcane, obviously is a natural substance and it's very safe, and it's just as effective as Retin-A. So I took the glycolic acid and I put it in a cream form. Now, the reason I put it in a cream form was to make it not quite so strong, but go on and then have the soothing effect of the cream. But the key important thing is that it's non-neutralized. Now, there's other people who advertise that they use glycolic acid, except the one thing that they don't tell you is when they make the product, the last step is they neutralize the acid to water. So you get nothing. It never burns, never stings, never does anything. With our product, I made sure that they did not neutralize it, and it does sting when you first apply it, but that's expected, and hopefully people will not get alarmed by that. But it improves everyone's skin when we use the non-neutralized acid, so that, you know, ladies, that everyone is busy, and we have a two-step approach that I've started where I have pH, where we have people wash with our pH balanced wash, which cleans their face. And then when they apply the non-neutralized glycolic acid, they get an excellent result. It improves all their glow. It makes them look terrific. It cleans out the pores for acne. It does all these good things. It has, since I've been using it since 1981, probably, 40 years, probably older than everybody there, right? It's never failed. It's always worked, and it makes everyone look better. And I recommend we start off with the facial enhancement cream because it's the milder one of my line, and it always makes everybody look better. Now, there's many new moisturizers out there, but this is the only one that's really worth using because it has non-neutralized glycolic acid in it. You can use other moisturizers that are just like fancy Vaseline, and that's fine. And that's all they are, just fancy Vaseline. But I prefer using this, and if now we even have trichloroacetic acid, which is the next step above it to even make people even look better. It works for everything, acne. Now in pregnant women that I can't give any medicines to, I use trichloroacetic acid to eliminate their acne and all the blemishes and brown spots that they have on their face. And it's very safe because trichloroacetic acid is also a natural byproduct of the body, and it's very safe to use. And it's very helpful for everyone.
Well, great. So that is basically our line, as Dr. B so well put it, that our products are truly bringing the dermatologist home to you. So dark spots, fine lines, acne, with our two-step, the pH balance cleanser and the facial enhancement cream together, morning and night, your daily cleanse, your daily moisturizer with that non-neutralized glycolic acid can really help to rejuvenate the skin and give you that nice glow. So, and just a little bit more about us. We are paraben-free, cruelty-free, certified by Leaping Bunny. We also are fragrance-free, made in the United States, and of course, clinically tested and dermatologist founded. So with that, we definitely want to get the questions going. And I also want to extend for everyone here today, we're so excited to be here. We're offering 20% off on dermchoice.com. You can get this two-step routine on our website and use code MOM20 at checkout, MOM20 at dermchoice.com to get you started. So yeah, definitely, let's get in the questions going.
Awesome. If people have additional questions, toss them into the chat. I did get a couple private questions, Gia and Dr. B, that I'll ask first, and then we'll see if additional questions come up. So the first one is, what do you recommend for, and I apologize if I pronounce this incorrectly, I had to practice all the words in your guys' intro. What do you recommend for melasma or pregnancy mask?
Well, that's a very frequent problem that we see. Now, the pigment with pregnancy mask is very deep in the skin. Okay, so that presents a problem that it's so deep. Now, the usual treatment you'll find is that people go into the dermatologist, they get some hydroquinone. Hydroquinone is a well-known lightening cream, and you can get it from 2% to 16%. And I've used it in all those different strengths. And that gets applied, and people walk out, and it really never ever does the job that you need it to do. The other thing with that mask of pregnancy, the thing that darkens it up is the sun. So it's absolutely imperative that every morning you wear a sunscreen and a hat. Now, as far as how you treat it, I have actually dermabrated it. Are you familiar with dermabrasion? Is where you sand down the skin. So I actually sanded down the skin to where there's a little bit of bleeding and all the pigment disappeared. The trouble is in some people, the pigment will totally disappear and stay away. But some people, when you go that strong and that deep, it'll come back actually worse. So that I have found over the last 40 years that when I use a milder acid along with the hydroquinone, it gives the best results. So we have an ultra anti-aging cream, which is non-neutralized glycolic acid, which is stronger than our regular facial enhancement cream. And we also have trichloroacetic acid, which is even stronger. So when you combine that with hydroquinone, you can usually get rid of about 50–60% of that pigmentation. Good enough that you will allow the woman to be able to put some makeup on and cover it up, and she'll look terrific. But it's really imperative that you try to make sure you protect it from the sun. Now, there's going to be times when you'll get some sun, and these women usually come into my office, and I give them the treatment with the acid solutions, trichloroacetic acid and the glycolic acid, along with the hydroquinone, to improve it. Did I answer your question for you?
You did. All right, and that was a really good one. We got another one via private message. See, Dr. B, all the people have the questions for you. So this one is, prior to having a baby, I had oily skin. After having a baby, it's become very dry or flaky. Is a facial cleanser with exfoliator the right option for that situation, or what do you recommend?
Well, if you have oily skin, we have the two-step process where you wash your face and then you use the facial enhancement cream. If you have oily skin, then I always add in a toner. Now, if your face is really oily and if you're really having a lot of acne problems, okay, then we have a glycolic face pad that we use, and that's even stronger than the regular toner. So if it's oily, skincare is also a little individualized. So you look in the mirror and you say, okay, my face is dry, my face is oily. It may be oilier on your nose, maybe oily on your forehead, and you have to learn how to individualize it for yourself. Okay, there's no one set treatment for anyone. So when people come into my office, I try to teach them how to use it, and we go through the different steps. So for her, when she had oily skin, I would have given her a toner and possibly glycolic pads to even get to the deeper oil. Now, once the oiliness stops and the hormones are going through a change and she's drier, then I just stay with the milder things, the facial, the pH cleanser, and then you use a sunscreen in the morning with the FEC at night, and that's all you need to do in her situation.
I like that. I have two more questions for you, Dr. B, and then some more might pop up. So these are both about pregnancy. So the first one is, are all of your products safe for pregnant and nursing moms?
Yes, they're all safe for pregnant and nursing moms. That's why I have glycolic acid, for one of those reasons. Number one, you don't need a prescription. Number two, it's made from sugarcane. So sugar may not be real good for us all the time, but it's not dangerous, okay? And that's why it's really great that it's made from sugarcane, and the safety profile. Obviously, for pregnant women, there's no way to check safety profiles. You can't test an item out and find out if it's going to harm you. But the fact that it's from a natural plant, I can't imagine any way that it could possibly be dangerous.
And then Dr. B, another one, are there any skincare ingredients that someone should avoid while they're pregnant or nursing?
Well, the retin-A's and the retinoids are well known to cause birth defects. So obviously you need to avoid that. Now, the truth of the matter is there's nothing really proven about many ingredients, whether they're safe or not safe. All the ingredients besides the retinoids are pretty much safe to use because the amount of absorption you get is fairly limited. So that's not really a major concern for most products on the market today. And by the way, if any of these items that you see advertised and in these lotions were dangerous over the past 50, 60, 70 years, that would have been recognized. And I'm sure some lawyer would have been really on the trail of that without a problem. So most likely I have not seen a problem with any of them.
All right, Dr. B, I have one more private message and then I have another question out here. So one says, can moles that appear during pregnancy, should that be something that someone's concerned about if moles appear during pregnancy?
We commonly see that. And usually, most frequently, those moles are the raised kind. The raised kind of moles are moles that we don't really worry about. And that's really not of that major concern. The big thing with moles is if it's flat and shiny, you have to have it checked. So if it's really super pretty and it's real shiny, it's right on the skin. When you see a melanoma or you see a skin cancer, you'll look at it and you'll say, it's incredible how shiny and pretty it is. And if it's just like in the desert, if it's shiny and pretty, it's usually kind of dangerous. And so that the raised moles that you usually get during pregnancy aren't really a factor or issue. Now, if it would happen to be that one of those moles would continue to grow, of course you need to check it. You just don't forget about it.
Awesome, Dr. B. We have a couple more questions in the chat for you. Also, Dr. B, I feel like I didn't know I needed to hear you today, but I think I needed to hear you today. I'm learning a lot right now. What are some glycolic products, glycolic product recommendations that you have?
Well, glycolic products, what I've done with my line is I have non-neutralized glycolic from the mild strength to the strongest strength. And even I take it past that. Now, in my office, I have all the strengths. I have 100% of everything. So that if somebody walks in that's 70 years old and has many wrinkles, okay, I can use phenol acid and eliminate all their wrinkles 100%. Now, that also has a lot of downtime. That's about 2 weeks of downtime, okay? Obviously I can't sell that kind of thing over the counter, but I wanted to give people something that they could do at home. And so that the different strengths of glycolic that I have does an excellent job at home. And that's what I recommend, is to start out with mine. And you continue up the scale as you get stronger and stronger, and you learn how to use it, and you'll look better and better.
I'll just add to that too. So here's a little visual. So we highly recommend the facial enhancement cream. So it's in this silver jar on our website. It's the facial enhancement cream. This is going to be your daily moisturizer with that mild glycolic. So if you've never used glycolic before, never used non-neutralized glycolic before, definitely look at doing this. Also say hello to Nicholas. We're all moms here. So Dermatologist Choice, a facial enhancement cream, definitely your first start for glycolic. If you want to step above, if you have more oily skin, the glycolic peel cleansing pads by Dermatologist Choice, that's going to be great for oily skin. That once a week treatment if you need that. To really activate that cell turnovers. This is going to be our second strongest product with that non-neutralized glycolic. And then, of course, the Ultra Anti-Aging Cream. This is going to be the next level, very similar to going to the office and getting that mild chem peel with that medical strength glycolic. So you kind of can decide what's right for you.
That's awesome, Gia. Thank you so much for sharing those. And then before I ask the next question, I just want to confirm the website that's up on the screen right now is the website people would go to, and the code is it MOM20, MOM20? Is that right, Gia?
That's correct. Yes. So dermatologistchoice.com or dermchoice.com. We also own those two domains. So Dermatologist Choice, dermchoice.com, and then MOM20, MOM20.
Awesome. Okay, we still have a couple more questions. Now the questions are all rolling in. Now we all want to tap in. So we have one from Megan. During pregnancy, what is the safest brand of facial cleanser to use? Is it safe to use Estee Lauder foundation?
Well, I'm not really familiar with Estee Lauder, but I can tell you what I do in my office. During pregnancy, obviously, I can't use any pills. That's why the pH balance cleanser I have and the toner, okay, are very important. But what I really do for those people is I apply trichloroacetic acid on their face every 2 weeks in place of the medicine, in place of using pills, because obviously I can't do any pills. That higher strength acid, which is, we have the facial enhancing cream, then we have the Ultra, and then we have the next strength up, which is the trichloroacetic acid. And that's what I apply on everybody's face every couple of weeks. And I keep their acne down and I keep everything under control. And that's how I do that. Now, the Estee Lauder brand, the only problem with that is that you're using, you're just using a little bit of cream, a little fancy Vaseline. And I can't imagine what it's going to do. But I mean, it won't hurt you, but it's probably not worth even bothering with. I mean, I can't sell something that's just water. So these are the same things I use in my office. And of course, I have a great deal of interest in making sure the patients get better. And so I've actually just converted it outside of the office up to a certain strength. Okay. So then I have to stop, and then you have to come into the office for certain things. But I would, if I were her, I would just go to something that's going to work.
Yeah. So our pH balance cleanser is a great cleanser.
Okay. Thanks for sharing that. And then we have another one in here from Jenny. What are tips to help with toddler eczema? And when should I have him checked if necessary? And there's two questions, so I'll let you answer that one first, Dr. B, and then I'll ask the second one. So the first one's just about toddler eczema, and at what point should she like have him checked out if she's concerned?
If you're talking about eczema in general, no matter what age they are, is pretty much treated exactly the same way. So the first and most important thing is the pre-bath oil. We have a pre-bath oil, and I have people use this oil before they take a bath or shower. Not during, not after, because that's what I learned when I was in school back in the 70s. And I had a patient back in 83 say he had eczema for 30 years, and I gave him the pre-bath oil. He used it, instead of using it during, he used it before he came in. It's the first time I've been clear in 30 years. So since then, you got to listen to what the patients say. Always listen to what they say, whether they're getting better. My son will help me out in a second here, but anyway, so you use the pre-bath oil, which is nice and safe, and then we always add to that steroid creams. There's very mild steroid creams you can use. There's other creams that you can use that don't have any steroid in them. First thing, most important thing is you get the skin moist and protected, and then you can add any of those other things. That's best that you go to the dermatologist and let him give you some of those other things that you might need.
Yeah, so the pre-bath oil by Dermatologist Choice, our line, Dermatologist Choice pre-bath oil is fantastic for eczema. You can find that on the site as well.
Awesome. Thanks, Gia. All right, we have a second part to that question, mom themed. Favorite facial tinted sunscreen if possible. So do you have a tinted sunscreen that you recommend, Dr. B?
Well, the tinted sunscreens, I don't have a tinted sunscreen. Okay. Am I against the tinted sunscreen? No. And there's some evidence that it probably does help a little. But I really push that people use a hat and wear long sleeves. And I don't mean a cap, I mean a wide brim hat. Now I've had 2 cancers already on my nose, and I've worn a wide brim hat since I was about 28 outside. Okay. So that's very important. The number of people, when you protect yourself from the sun, that's the most important thing. And sunscreens do fine, and I like those, but I think wearing the hats are even more important than any of the things we're talking about now.
All right, Dr. B, this question has been asked and then reiterated by another person in the chat. So this is a hot topic one. Do you have any products that you recommend to support stretch marks during or after pregnancy?
Well, we have dealt with stretch marks for many years. A stretch mark, actually what a stretch mark is when your skin gets stretched, the collagen fibers actually break. Okay. Now, when the collagen fiber actually breaks, there's not a lot of things you can do about that. Now, you could theoretically do an excision, sew it back together. Okay. We don't recommend that. We've used Retin-A for that. We've used glycolic for that. We've used moisturizers for that. And those are the things that we generally do. Now, how well will they work? Unfortunately, when you're talking about where the collagen actually breaks, you can get some improvement, and actually time will also help improve it. But will you get rid of it completely? Unfortunately, that would be almost next to impossible. Now, I haven't seen the results, but microdermabrasion, micro needling underneath the skin may help stimulate that, but the likelihood is pretty slim. So I think moisturizing using Retin-A, using the glycolic is your best bet for that problem.
Awesome. Thank you, Dr. B and Gia. All right, so we're going to close up this part of the questioning right now. Dr. B, thank you so much. I know I just learned a lot. I'm probably going to have to invest in a wide brim hat because I definitely do not wear one right now, but my mother does. And I feel like I can hear her voice in my head right now. So that I'm going to Amazon that tonight. Thank you so much for all of your sharing. Dr. B, one more quick question, just in case any other moms are wondering this too. You have lines of products that you can purchase online, correct? Or if someone wanted a lengthier consultation, they could also meet with you as well. Is that correct?
Yes, of course. Yes.
So Dr. B, his office is Alliance Dermatology at 40th and Bell in Phoenix. 40th and Bell in Phoenix. So it's called Alliance Dermatology. You can also email us. You can email me, Gia at dermchoice.com, gia@dermchoice.com with any questions. And of course, you can shop our whole Dermatologist Choice line at dermchoice.com.
You have my last name, so you can just see the address. 40th Street in Bell.
Leon, Dr. Leon.
That's wonderful. Well, thank you both so much for being here and sharing with us so much amazing wisdom. I know I learned a lot. Danica has put out a request in the chat. If anyone has any cute wine brim hats that they'd like to toss some links into the chat, we can all learn from each other right now. So thank you guys.
You can always get